this evening. Healthcare startup focused on solving primary healthcare in remote locations through an innovative hybrid model, CureBay has raised 62 crore rupees in its Series A1 funding round. Now, the round was led by Elevar Equity, their existing investor, and saw participation from CureBay founders and some of the leadership team members. With the fresh funds received, CureBay aims to build an intelligent and robust health data platform and hire the best tech and healthcare talent in the industry. To elaborate more, joining me now is CureBay's founder and CEO, Priyadarshi Mohapatra. Priyadarshi, welcome to Startup Street. You provide healthcare in remote locations of India by offering affordable, quality primary care through a network of satellite health centers. If you could take us through your offerings, the business model, and how are you solving healthcare challenges at the grassroots level?
Thank you so much for having me on the show. So the CureBay model is very innovative. It's a hybrid model which creates access to high quality and affordable healthcare in the remotest medically underserved locations. In the front end, we have physical clinics that are managed by 2 healthcare and certified workers, a nurse and pharmacist. And in the back end, we have a very robust tech platform developed on the continuity of care, where the physical healthcare ecosystem is aggregated and is available to collaborate real time to deliver their services. So what we do, we actually try to mimic the experience of what an urban patient would get when they walk into a polyclinic in an urban market to a rural and medically underserved markets patient by first getting the preclinical screening done through certified healthcare workers using medical grade devices, capturing all their vitals that is required for a doctor for consultation. Immediately after that, digitally, a doctor consults them and gives an e-prescription. And while the consultation happens, there are people present with the to give any kind of assistance that the doctor needs. Post the consultation, we take the prescription as a digital prescription, and whatever is the call to action is fulfilled there at the center.
You have blended a distribution model, which is obviously augmented with technology. But let's now talk about the fund allocation plans. You plan to strengthen your platform and hire over 200 professionals. If you could elaborate on these.
Because we truly believe that we are building one of the largest health. The second area where we're going to invest is high quality medical professionals in areas that we have. Investment is going to be in creating a membership program which really helps bring down the out-of-pocket expenses of patients.
All right. Priyadarshi, as part of your growth strategy, you're also focusing on driving profitability and data monetization. If you could elaborate how you plan to do that, if you could talk to us about your revenue streams and the road to profitability, how's it looking like?
Yes, this phase is critical for us to drive profitability. So the way we are looking at driving profitability is at a circle level. A circle we define as a cluster of 50 clinics where we build the entire ecosystem from doctors, pharmacy hubs, diagnostic hubs, and we ensure that medical outreach programs and logistics is managed within the center. So our objective is to actually arrive at operating EBITDA profitability at a circle level. Almost all the services from doctor consultation to medicines to getting the diagnostic done is done right at that clinic. And we also work as a very, very strong referral models for any patient which is requiring tertiary or secondary help.
All right. CureBay has also connected over 100,000 patients in underserved areas with healthcare providers. Tell us how you're ensuring affordability and reducing out-of-pocket healthcare expenses. Also, if you could talk to us about your partnerships that help you achieve this.
Totally. So one of the innovative ways in which we are trying to drive affordability is to really bring down the out-of-pocket expenses. So we have a program which is called as a CureBay membership program, by which for as low as almost close to 1 rupee a day, a rural patient gets free doctor consultation, access to free specialists, very attractive discounts on their pathological tests, on their medicine purchase, which is branded and ethical medicine. More importantly, we offer them a program by which, if at all they have to go for a tertiary requirement, their out-of-pocket expenses like travel and loss of incomes are covered through a program of ours. We do this in strong partnership with our partner Bima Plan, who underwrites some of the cost expenses, and the rest of the services are brought on our platform. A large number of hospitals, diagnostic partners it's
Okay.
not just about bringing affordability through economy of scale, but also through innovative leverages data.
All right. One final question before I let you go. In the next 6 to 12 months, you plan to raise your count of clinics from the existing 90 plus to over 200 across Odisha, Chhattisgarh. You're also planning to enter Jharkhand now. If you could elaborate on these plans quickly, and if you could also give us some timelines.
Yes. So we are already present in Orissa and Chhattisgarh. We're going to continue expanding in both these markets. Chhattisgarh is going to expand into the circle format soon. And towards the second half of the year, we are looking at entering the neighboring state, which is Jharkhand, because in healthcare, you see that there is a cross movement of patients across adjacencies and states which are close by. So that's how we're planning to expand.
All right, Priyadarshi, many thanks for joining us on Startup Street and wish you the very best in all your growth plans.
Thank you so much.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.